It's raining cats and dogs here in Sydney. Almost reminds me of my hometown, Mangalore. So today I want to talk about a condition you may or may not have heard before called endosalpingiosis. It's often shown in surgical or pathological reports and can sound a bit alarming, but I'll explain what it means and how we manage it and why it's not something usually to fear. So what is endosalpingiosis? This is simply a condition where the type of cells that normally line the inside of the fallopian tube are found on areas such as, say, the ovaries, the pelvic lining, or the peritoneum. These cells are benign, which means that they are not cancerous. We usually come across them during surgery or when a biopsy is done for other reasons, such as pelvic pain, ovarian cysts, or suspected endometriosis. How does this differ from endometriosis, you may ask? Now, you've heard of endometriosis, which is much more common. In endometriosis, the lining that grows inside the uterus at times can get deposited outside, and it causes pain, heavy periods, or fertility problems. Endosalpingiosis is slightly different. It does not cause the same symptoms, but it can form nodules, cysts, and look very similar to endometriosis or even mimic more serious conditions. That's why in practice, we treat them the same way. We carefully excise all the abnormal tissue whenever we see it. Now, do you need treatment? The good news is that endosalpingiosis itself is not harmful. However, when we do find it in surgery, I always make it a point to actually remove it. Now, there are a few reasons for it. First is to confirm the diagnosis under the microscope, since it can look like other conditions. So it's very hard to call it out in surgery saying this is exactly endosalpingiosis or this is endometriosis. Second is to restore the normal pelvic anatomy, especially if the lesions are causing adhesions. And third, in women who are planning to fall pregnant, excision can actually protect the fertility by preventing blockage or damage to the ovaries and tubes. So while it's not dangerous in itself, removing it can provide both comfort and improve the reproductive outcomes. So in summary, endosalpingiosis is a benign, as a not cancerous condition, often found by chance, I have to say, and we usually excise it in surgery just to be safe, to relieve any symptoms and to preserve the fertility. Now, if you've been told you have it, remember, it is not cancer, it's not life-threatening, and can definitely move forward in life confidently. Thank you for